Welcome to a mnemonic video on hyperprolactinemia. Let's get started. This scene will take place outside the local ice cream shop by the movie theater. It looks as if the ice cream man is having some trouble with its soft serve machine. Just look at the milk spewing everywhere. Prolactin is a hormone that stimulates milk production. So all of this milk should make you think of hyperprolactinemia, reminding us of the focus of this story. Although the machine seems to be a disaster, at least the price for a cone is not too steep. Looking above the machine, we see the price of a cone is greater than $2. This sign should remind you that the diagnosis of hyperprolactinemia requires a serum prolactin level greater than 20 nanograms per milliliter. Looking to the side of this man, we can see an advertisement for one of the movies. The movie must feature a genie, as we see a cardboard cutout genie unfortunately placed in the milk splash zone. Looking closely, we can see that this genie has red hair. Genie with red hair can be abbreviated GnRH, which should remind you of gonadotropin-releasing hormone, also abbreviated GnRH. This hormone is released by the hypothalamus and stimulates hormone release from the anterior pituitary gland. It's almost as if this genie knows that he has ice cream splattered all over him. He appears to be a bit angry with a frown and crossed arms. This inhibitory stance should remind you that prolactin serves to inhibit the secretion of GnRH. Looking at his crossed arms, we see he is carrying a bottle of fish food and a yellow flower. Yellow in Latin means luteum, which should remind you of the luteinizing hormone, abbreviated LH, as well as the corpus luteum. The LH surge during the menstrual cycle triggers the development of the corpus luteum. That's why we chose this yellow or luteum flower to symbolize the luteinizing hormone. On the other hand, we see a bottle of fish food. Fish can be abbreviated FSH to remind us of follicular stimulating hormone. These two hormones, LH and FSH, are released by the anterior pituitary in response to GnRH stimulation. As previously mentioned, prolactin inhibits GnRH secretion. Therefore, low levels of LH and FSH are diagnostic clues that indicate hyperprolactinemia. Here comes a prospective customer. This customer looks like she will be buying ice cream for two. Just look at her pregnant belly. A heroic man steps in at just the right time to stop her before she gets too close to the milk splash zone. This man, excluding the pregnant woman from the milk splash zone, should remind you that pregnancy should be excluded with a beta-HCG test as part of the diagnostic workup for hyperprolactinemia. Maybe this pregnant woman is buying ice cream for three. Here, we see the pregnant woman's son walking beside her. He is dressed up for his trip to the ice cream shop. Look at the small bow tie around his collared neck. This small bow tie is a recurring symbol for hypothyroidism. Hypothyroidism can cause hyperprolactinemia, so it's a condition that should be ruled out in the diagnostic workup of hyperprolactinemia. Here's how that works. Thyrotropin-releasing hormone, or TRH, is released by the hypothalamus and stimulates prolactin secretion from the anterior pituitary. TRH is normally inhibited by thyroid hormone through negative feedback. If thyroid hormone in the body is low, as it is in hypothyroidism, prolactin secretion is stimulated with no negative feedback control mechanism. Therefore, you see hyperprolactinemia. To check thyroid levels in the body, we check a serum TSH and T4 level. If TSH is high and T4 is low, we can diagnose hypothyroidism as a possible cause of hyperprolactinemia. Here comes a solution to our ice cream machine disaster. To the right of the broken ice cream machine, we see a new ice cream machine. This ice cream machine looks a little more technologically advanced than the broken down one we started with. Also notice that it resembles a CT or MRI machine. This should remind you that a head CT or MRI is part of the diagnostic workup of hyperprolactinemia and will reveal a sellar lesion, which is usually a prolactinoma, a prolactin-producing tumor in most cases. Pregnancy and hypothyroidism are not the only conditions that need to be excluded in the diagnostic workup. Some drugs can cause hyperprolactinemia and should be ruled out as well. So we'll discuss some of the most commonly used drugs that can cause hyperprolactinemia. Looking behind the mother and son, we see a shady guy coming to visit the ice cream stand. Just look at his hands equipped with metal claws. Metal claws sounds like metoclopramide, a drug that can cause hyperprolactinemia. Metoclopramide is an antiemetic that works by inhibiting dopamine receptors. Dopamine normally works to inhibit the release of prolactin, so inhibiting its action with a drug will remove this inhibition, thereby leading to an increase in prolactin release. Therefore, part of the diagnostic workup of hyperprolactinemia should include a glance at the patient's medication list. Metoclopramide is not the only drug that can do this. Look at this man's shirt. It has 2 hissing snakes, our symbol for histamine receptor 2, also known as H2. Looking closer, we see that the shirt is damaged over the picture of the 2 snakes. These 2 damaged hissing snakes should therefore remind you of histamine receptor 2 blockers, often abbreviated as H2 blockers. H2 blockers treat GERD and also have the side effect of hyperprolactinemia. This man is not the only shitty character in our scene, however. Looking behind the metal claw-handed fellow, we see a psychotic-looking man crouched down on the ground. This man is wearing a large X on his chest, which should remind you of antipsychotics. These drugs are also known to cause hyperprolactinemia. Therefore, it's important to check the drug list of a person with hyperprolactinemia to see if a medication could be causing the condition. So as a brief review, when working up a patient with hyperprolactinemia, consider pregnancy, thyroid disease, and medications, especially metoclopramide. Now let's move on to talk about the treatment of hyperprolactinemia. Looking off to the far right at the poster on the wall, we can see a promo code on it. Promo code sounds like bromocriptine, which is a dopamine agonist used to treat hyperprolactinemia. Dopamine inhibits prolactin secretion from the anterior pituitary. So by giving dopamine, prolactin secretion is decreased. Therefore, it's the best initial treatment in the setting of hyperprolactinemia. Looking next to the promo code sign, we see another attraction. Dancing in front of a purple curtain, we see cabaret dancers. To get inside this cabaret, you need to go and wait in the line. It's even stated up there instead of the place's title, Cabaret Go Line. So, putting this together, the Cabaret Go Line should remind you of cabergoline, which is another dopamine agonist option used for the treatment of hyperprolactinemia. Looking over, we now see what the promo code was for. It must be a promo code for a new medical movie, as we can see from the movie poster above it. The title of the movie is Surgery, and we can see a surgeon with a scalpel on the poster. Well, this surgery poster reminds us that surgical resection is the treatment of choice for pituitary adenomas refractory to the medical management we've discussed. Surgery is also indicated if the pituitary tumor is causing visual symptoms. The pituitary gland sits just under the optic chiasm, so when the gland enlarges, it compresses the middle of the optic chiasm and causes bilateral hemianopia, which is loss of the temporal visual fields. And with that, you know everything you need to know about the diagnosis and treatment of hyperprolactinemia.